It's another lovely day, isn't it? And I always want to ask everyone, how are you? Because that question at first used to be something we ask by way of greeting, but now it means more than just that, because I need to know you're okay. Okay, our lines will open up and you get to answer that. And at the same time, I want to wish you happy Valentine. Yesterday, we started a conversation, and that was around COVID-19, the new norm, coping with it within this period. And I'd like to say that a lot of times when life presents us with a lemon, we actually try to make lemonade out of it. That means we should not complain. Some people already sent messages, waiting for us to start. Don't worry, we'll start. Habiba, you said you're looking forward to today's edition, and we are too looking forward to your participation via your messages. And I told you yesterday that we'll be expecting you to write certain things to us. I'll get to break all of that down. But let's join Francis as he puts us in the mood for today's edition of Weekend Deal. That's the background.
The coronavirus pandemic has drastically changed the way people live, act, and work. Besides changing social and work ethics, measures taken to contain the virus have also reshaped the rules of everyday etiquette.
It has not been the same. It has not been the usual life we used to know. You must go out with a face mask. You must use your face mask. You must enter a taxi with a face mask. You must maintain some distances between people and all of those. But although all of those don't get complied with, especially when it comes with public buses and taxis, but it's something we must have behind our mind to be able to run our lives well. At a time like this, you must wash your hands. I recall when it was very hot at the beginning, the first lockdown, I would go to the market. Someone would just hit me and get me angry and say, oh, why will you touch me in the market? And all. When I come back home, I just pull my dresses quickly, wash my hands, and go and take my bath. Those are very, very abnormal things, because those are the new normals we are seeing during COVID-19.
Sports is one of the sectors greatly hit by the virus, as the Olympic game was postponed. While football is up and running in some countries under strict conditions and in empty stadia, athletics are so far engaged with virtual competitions involving competitors operating individually, but at the same time linked by video.
I noticed lately, as we've been dealing with COVID-19, that days when you will see the stadium will be very full, people are falling over each other, pa, 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 pa. We no go win, no, we no go win. You don't see all those again. People are restricted to their homes right now. If people are in the stadium right now, you see them, one person here and another person at the other end. No much contact. I think it's the new normal we are seeing in during this era of having to fight COVID-19. And if it's something we must do to conquer, we will conquer.
The coronavirus is also affecting the entertainment industry across the globe. Consequently, practitioners in the sector have had to get creative with staying productive and safe during the COVID-19 pandemic. Although the go-ahead has been given for religious houses to open, it may take some time before full activities will commence. For those that have opened, there are additional rules around the distribution of communion, for instance, cleaning between services and the use of hand sanitizer.
From coming into the church, for example, the security man checks you, make sure you are not carrying anything, for example, and then they lead you to our washing hand place. And then there's a sensor. You just place your palm, and soap comes out, water comes out, and you rinse your hand. And then you move from there. Before you enter the auditorium properly, there is a tunnel. And before you enter the tunnel, you will have also sanitized your hand, number one. You will have checked your temperature on the wall, number two. And then you walk through the tunnel. You get sanitized, your legs. You see pumps and punches into your legs and your heart, your hair, and your palms and hands before you enter the church. If you get into the church, there are space at least 2 meters apart. It is compulsory for you to wear your face mask in the church. You must wear, if you must come in, you must come in with a face mask. That's the amazing thing is, we get a lot of handshakes and hugs in churches, and a whole lot of that has reduced now. Very few hugs, unless very close friends, family, people that know each other very well, they shake hands and all, but some of those have reduced in churches across board.
For businesses to survive in these times of distress, the need of the hour is to promote virtual shopping and use virtual marketing tools to make it an enjoyable shopping experience. Amazon, for instance, remains one of the few companies to benefit from the coronavirus pandemic, with surging online sales helping it to report record profits in July 2020.
Before now, you must go to a marketplace or a shop before you could pick up anything. Good news today in our trying to cope with the issues of coronavirus, you could buy food online. You could just order for food online, and the food will be delivered to you in your house. You could order for just anything, shoes, get a picture of the shoe, get a picture of everything you want, and then they could deliver it to you. That's what we are dealing with, the new normal we are dealing with today as far as coronavirus is concerned.
As the coronavirus continues to increase, the federal government e-government plan 2020 becomes highly necessary to improve digital operations and services across ministries, departments, and agencies. Therefore, our focus on Weekend Deal today will be on life in terms of COVID-19, the new normal.
All right, that's the new norm and the background for today's edition. A lot will be unfolded. By the way, yesterday, just talking about online shopping, a colleague of mine ordered for everybody, hot akara online with pepper. And I tell you what, I thought it was a joke. He came. And it was as good as the ones we'll find in the house. A whole lot is happening, and we can get to do even more. And we say thank you to all of us as we enjoyed it. And for now, we often hear about e-governance. E-governance, does it happen in Nigeria? I don't know. But how can we begin to understand it and, of course, fast track it? Suleiman Babajia did a good turn on this. Let's watch.
Hello.
Hi, what's up? Good morning.
I'm good. What's up? What's happening?
I'm okay, we're just home.
How is the lockdown treating you?
It's been really boring.
Really?
Yeah.
You mean your work is not engaging you at home?
In our ministry, we don't have any kind of digital connectivity, so we've not been doing anything from home. I even spoke with some of my friends in other government agencies and parastatals, and then the experience has been the same thing. They're just idle.
Conversations like these were common during the peak of lockdown in the country. Many government workers were made redundant, arguably exposing the limitations in the application of e-government in the country.
If you just quantify the salary of, let's say, level 12 person below in the government, it's easy to get those data analysis. That alone shows you the revenue, part of the revenue that has been lost. And mind you, it's not just the salary. Whether we like it or not, level 12 below are the major engine forces. They are the processing officers in agencies. So imagine the process that is meant to have taken place in 1 week is being taken place in 3 weeks. So the time value, if you convert that time value into money, it's something.
There is a center built by Korean government and donated to the Nigerian government. So we are doing that center to train government staff on how to use e-governments, on digital literacy, and other skills they need to transform government services.
The federal government launched an e-government master plan in 2019 to improve digital operations and services across ministries, departments, and agencies. This is to ensure efficiency in public service, block leakages, and improve transparency in government dealings. It is said that if this is fully implemented, corruption were reduced drastically.
The president came on board, the first thing he did was single treasury account. That is also using e-government. If you look at the kind of leakages it blocked and the money it saved for government is a lot. BVN is one, another one, IPPIS, GIFMIS. All these initiatives are the government initiatives to implement e-government.
However, despite policies aimed at improving Nigeria's digital ecosystem, the country is still ranked 141 out of 193 countries in the latest UN report on e-government development index. Nigeria is not among the top 15 in Africa. The survey shows the pandemic is pushing most countries towards digital government with noticeable improvement, but digital divide is still a challenge. Government workers are part of the over 120 million Nigerians with internet subscription. While service providers are smiling to the bank, some subscribers are complaining about the cost of data.
Actually, data is a bit expensive now, I would say, because as an individual, I spend a lot of money now on data, if you ask me. Like, on average, I spend close to 5,000 on data in a month, if not more. Because if you know, by the time you subscribe a bundle of, let's say, 6 gig, 2,000 naira, less than 2 weeks is exhausted.
If you look at it, whether we like it or not, we still have a problem with our energy system. If there is no light, there will be issues of these services. If there is no security, because you end up seeing some of the transmitters and the boosters, they are in remote areas where there are still prompt security issues. And if you still go to those remote areas, I think, it's an overhead, not a real figure of analysis. I think 70% of all our antennas and boosters, they are being fueled by diesel.
Interestingly, in the 2020 edition of its Inclusive Internet Index, the Economist Intelligence Unit ranked Nigeria 25th globally and first among African countries with the most affordable data. COVID-19 pandemic is indeed challenging governments around the world to accelerate their e-government development.
Now we understand how we can fast track the e-governance. And when we say governance, it's all about us, you, me. That's the meaning of democracy. So we all get involved. Yesterday, we brought to you the new norm with the tertiary institution that's talking about education, how things have been structured and restructured. Today, we're going to, go down to the secondary and the primary section, and this is courtesy of NTA language, NTA knowledge, and precisely Helena. Let's see it.
Before the outbreak of COVID-19, students had normal system of education without fear or social and physical distancing. Then, there were directives from the federal government of Nigeria to close all schools as a precautionary step in preventing further spread of COVID-19. This change brought about the current online approach in the educational sector.
Comes up, which is what? How will it be produced?
When COVID-19 broke out, we had to think of ways by which we can reach our pupils and students, more especially in the rural areas. Consequently, some of my lieutenants, with the support of the FCT administration and the UB Commission, and also the we brainstormed for nearly 2 weeks, and we came up with a reasonable idea. And we started thinking of how to reach the pupils and students through television broadcasts and radio.
E-learning started in FCT. The idea came in during the pandemic, but prior to that, we have our own way of reaching out to the students during holidays through WhatsApp learning, through sending assignments through mail, and school portal.
An impact of virtual learning in the Federal Capital Territory, Abuja, has witnessed some progress.
We made alternatives by sharing about 1,500 radio sets to 300 communities. It's an option. Because certainly, where you can get access to data is not within municipalities and maybe local government headquarters. But with radio and just pure battery, you don't need generator to power your radio.
Greater number of learners from poor and low-income backgrounds are at a disadvantage due to limited access to learning platforms.
A lot of challenges indeed, because most of the parents do not even have the devices, and you find out that the students themselves also do not have the means, because their parents do not have the devices for online learning. And those few that have it too, you have the problem of data.
Many of them may not have access to handsets, tablets, and computers.
This online teaching, I can't get it on radio, I can't get it on TV, mostly because at times there is no light.
I prefer being in school, talking to my friends, interacting with teachers. I miss a lot of my teachers. When we came back to school, I was really, really, really happy.
We most time go out of our way to ensure that the students get the assignment done. And of course, the harsh economic environment we are, most times the network in trying to assessing those assignments is really not very easy.
In times past, a child belonged to every member of the society. Now more than ever before, we may need to revisit our valuable cultures of times past. Because when all hands are on deck and our children succeed, we all succeed.
Nice one, Lena. Thank you very much. That's a courtesy of NTA Knowledge. And before we took that feature, I told you that we have experts in the house who will be, guiding us into certain discussion. I want to call it discussion because it's not question and answer. We're going to have, chit chat and get to find out how things are working still within the educational sector. And so to do justice to that, I have a man who I want to address as a friend of the house and a friend of education, because all his life he's been following the road to education, and his voice has always been heard. He is the recently retired director, and that's a Universal Basic Education, and that's Dr. Adamu Noma Zatao.
Thank you very much, Dr. Adamu Zatao Noma.
Okay, Dr. Adamu Zatao Noma. Yeah. I'd like to ask, it's 10 months after your retirement. How does it feel? I was looking at you, I was envying you.
In fact, I've been very, very happy.
It's good, and we pray we all get there one day. At the onset or outbreak of the COVID-19 last year, we never knew we're going to take this dimension, to a lot of things, including education. A lot has been said about online education. The mainstream media houses have also gone involved in it, both radio and TV. Tell me, sir, what's your view on it generally, assessment?
Well, thank you very much. You see, when COVID-19 came, it caught everybody by surprise. This was not what people prepared for. Nobody prepared, nobody envisaged that something like this was going to happen. So nobody was prepared for it. But when it came, we waded into it, and there was no choice that it appeared that we had to live, we had to do whatever we could to make sure that education takes its rightful place within the context, within the environment of the COVID-19. So what did the education managers do and the education and the other practitioners do? Well, people now have to devise ways of how to mitigate that, because the end is not easily foreseeable. That nobody can easily now tell, nobody can forecast and say, well, maybe in the next 2 months or 3 months we'll get over COVID-19. So because of that, even teachers are now thinking that it appears this COVID may not likely leave us on time. Every teacher is now thinking of how he will now manage the situation, because it is that is the only way. How do you manage, the the educational system within the context of the COVID-19. One of those ways is, education online. And, teaching online is simple, but very, very complicated. Very, very complicated in the sense that, you see, you need to have the facilities. Now, here in this part of the world, those facilities are not yet easily available the way we would want them to be, so that every child will have access to those facilities. The facilities are there.
When you speak of facilities, I'm sure you're talking about the computer, the
Yes, the
data,
computers, even the handset and so on, iPhones and so on. These things are not yet easily available, particularly to children that are in rural areas. If you take this environment, for instance, how many schools are in the urban centers? Very few. But the majority of our schools are in the rural area. So there are so many challenges. Now, even where education managers now decide to go online to teach the children, if those facilities are not there. Now, even where you can say, okay, one or two students, can use one, maybe other computer or one handset and so on. Remember the social distancing. That is already a factor.
affected.
So it's already a factor. Trying to now, challenge the usage of one set of computer for two or three, students. Because if two or three students have to use one computer, that means they have to sit, very close to each other. Why they will not sit and then discuss, and you see, already it is a factor. So now, where they even have that, what of the power supply? Do you have power to power those things for about 3 or 4 or 5 hours? Now, where even the power is there, what of the internet service? You see,
There's multiple problems.
Yes. So you see, you find out that the teacher is confronted while he's devising ways of how to mitigate this. There are so many other factors that are challenging him. Yes.
Okay. Now, maybe these factors that are challenging them for the internet, that's the online teaching, was what gave birth to the radio education and TV education. I know that, for instance, NTA Knowledge has, at the moment, it has full-time school following the school syllabus as at today, and it's 24 hours. So maybe that's what happens. But I also know that the radio programs in Kaduna, Abia State, I think Akwa Ibom, and some other states.
FCT here.
The FCT. They are going
Universal
on.
Basic Education Body is running a radio program.
Okay, that's nice to know. Now, how well has that one fared for the kids?
It is still limited. You see, anytime you talk about some of these things in the rural areas, it is not easy because they have to be properly educated. Now, one can even say how much is a small transistor radio that with 1,500 or 2,000 you can get it. But I want to tell you that it is not easy for the rural areas to get in the rural areas. I remember when I was the board secretary of FCT Agency for Mass Education then, in non-formal education, we had a program called Literacy by Radio, where we were using radios to teach our learners. We did that, and it was very, very successful. But it was successful because we made those radio sets available to every learner.
I was just going to suggest maybe these things are provided.
Yes, if
to the learners.
I think what to do is we have to own up both the government and other, NGOs. People can support. That can be done. That can be. I don't think it will be too much because with 2,000 naira, small radio set can be bought and shared to students. I know that we can afford that. Even if government alone cannot do that, there are people in the society that can buy 100 set of such. If a small radio set costs 2,000 naira, for instance, somebody can volunteer to bring about 400,000, and he already takes care of about 200 students. So
with the radio and TV, these ones are definitely missing, and people are complaining. Students slip off. What is there a way we can, remove some of these challenges?
No, I just want to tell you that you see, for us as professional teachers, Where you teach and students are no longer interested in what you are teaching, then something is wrong with your strategy, with your teaching methodology. There is no way I, for instance, can go to class to teach and anybody will do it. It's not possible. Because there is no way I will teach.
I wish I would be in your class one day.
Oh yes, why? If I go to teach, there is no way any student will do it during my own lesson. Now, while packaging such lessons should be made in such a way that it will carry the students along. If you just sit down in the comfort of your office and then you begin to talk, making lesson a storytelling lesson, students who are listening out there will doze off. They will doze off. So it depends on how those lessons are presented. You present them as if you are just there. Even when you ask the student to do this, there is a way you present it that you carry them along, and students will be doing that. Though they don't see you, but they will be doing that. So it depends on how the lessons are packaged. Now, this need experienced teachers who package such kind of lessons and present it to them.
Okay, I was watching or listening to one of the radio programs. Actually, a governor was there teaching biology, and the lines of the radio station was open, and people were calling in. Is that part of how it should be done? Are there other ways?
If you do that, how many lessons are you going to cover? If you allow the if I'm going to teach a lesson now to all the students in FCT, for instance, and then you open up that line, that in 45 minutes you'll be talking and everybody will be asking you questions. You can't go to anywhere.
So what other ways can we, take to ensure?
You present. There is a way you present your lessons, and then you can now collect the questions, and then you can now have time where those questions will be answered, and then you explain them, and even those who are not there will be able to understand you. They'll be able to follow you. That this social question, if it is like this, this is the answer. If you do it this way. It is like this, you get this. They will answer. And then by the time you answer some questions, one or two questions may answer so many other people's questions.
Okay. So let's say there are some people I noticed that when the thing is going on, they actually record to play back later, which is a good one. Now let's look at solution, because COVID-19 is not looking like it's going to go away for now. What can we do to ensure that Nigerian students are, keeping up like they should?
Well, it's just teachers will now have to be encouraged to devise several other methods on how to mitigate this. Now, one of those things is that teachers now will have to be made to sacrifice more. Already teachers are sacrificing. Now, take for instance, I'm made to understand now that in the FCT, most of the schools are now running shifting system, the shift system, morning and afternoon. Now, if teachers are going to run morning and afternoon session, what is the implication? The implication is that a teacher goes to school by 7:30 because lessons start by 8 o'clock. So a teacher should be in school, latest by 7:45 to prepare his class. Now, how can that teacher remain in school from 7:30 to 6 o'clock? It's not going to be possible. That teacher will not be effective, because you are either going to be effective in the morning, then the afternoon session will suffer, because at that time you are already exhausted. No matter how good you are, you cannot teach from 8 o'clock up to 6 o'clock in the evening. It's not going to be possible. So you see, the implication there is that here you need more teachers.
We need
that
more
means
teachers, definitely.
more teachers will now have to be
employed.
To be employed. So that
then even some retired people like you who are still very active, very agile. You are retired, you're not tired. We can still come to you to do some of those things.
Come to my house now and I teach them geography. I teach them geography in my own house right now.
Wow.
Students come to me and I teach them geography lessons. So you see, that is one of the implications that for teachers to come to school by 7:30 and remain in school till 6 p.m. is not going to be easy for him. And not only that, you find out that the normal lessons where they have about 8 lessons in a day may not be possible again, because the morning session will have to close by 12, or maybe by 12 or 12:30 instead of 2 or 2:15. You can see that. And then the same thing, those who are coming in the afternoon, when they start their lesson by 2:30 or 3, then they have to close by 5. The reason is that no parent will allow his child to remain in the school environment till 6 o'clock because of some
definitely.
other factors.
As of today, we still have a lot of fears. Different strands, different variants are coming out, and it's our responsibility to ensure that we keep our children protected. But speaking of that, I know that a colleague of mine, we're just talking recently, says that her child learning at home and doing the radio thing is more job for her because she has to sit down. It's still a little bit off toddler. You know, she has to sit down. Now, what is your own advice, briefly, for the parents to ensure that their children keep up the pace?
No, I thank God now that if that is now making parents to be more responsible, that is very, very good. Because there are so many parents who don't even care, who don't even monitor what their children are doing. If that is now bringing about, parents getting now attached to their children, that is a very good development. But the total thing is that parents will just have to be more dedicated. They now know that their children are at home, that those things that they were not doing to assist the teacher, it is now time for them to now help the teachers too. That a teacher may not be able to have about 6 hours now, 6 or 8 hours to spend with the child. So the parents now should now balance up that gap. The parent may not know anything, but for you to say, okay, it is time, go and sit down. Even if you don't know, assuming it is mathematics or geography, for instance, even if you don't have any idea of mathematics or geography, just go and sit down there. Your child, yes, and watch him. Your child will no longer.
I just pray that that parents will not be like my grandmother, who I will show my book like this. She was not learned. I give it to her like she collects it like this, so she reads the book upside down, and she'll be telling me, "You scored very good well. You know.
No, it doesn't matter. You see, the what matters here is that the child sees his or her parents sitting down will no longer play. If you are not paying attention, even your illiterate parent will understand that you are not paying attention. They will know that you are not paying attention. But when you are serious working, you are doing this, you are doing one thing or the other, the parents will know. If you are trying to, if you don't know geography, if you are practicing how to draw the map of Nigeria, for instance, your parents who never went to school will know that this child is trying to do something. And I want to tell you that whatever a child does, once he is sitting, in front of a table and begin to do something, it's not a wasted time. He is doing something. He will be getting something because one thing or the other will be coming up him.
All right, thank you so much, sir. And it's always a pleasure. I think this is the second time I'm speaking with you, and each time you mesmerize me with your intelligence and the solutions you always bring to board. Thank you very much. We'll be speaking with the former director and secretary, the Universal Basic Education Board here in FCT, in the person of Dr. Adamu Jatau Noma, and you can be sure he's just spelled it all. It's COVID-19 disease. It is not something targeted at any section. But whoever is affected, like all of us are, you must ensure that we keep our hands on deck, especially when it comes to monitoring our children, personal hygiene, and education. For now, let's take a break. Let's move on to Oga to get to find out the scenario still on online worship.
The COVID-19 pandemic has resulted to a lot of new changes in the ways of life of different people from different places. Greeting habits like handshaking, hugging, pecking, among others, have been abandoned as precautionary measures to curb the spread of the disease. As a result, worshippers are equally mandated to observe the protocols in the course of their worship. This development has led to the promotion of online worshiping, which permits worshippers to follow their religious leaders and worship with them through digital apps like YouTube, Facebook, Zoom, among others. Reacting on the current practice of online worship section and its challenges, Venerable Chima Ugochukwu noted that online worship is good but does not completely meet with the spiritual needs of the congregation.
Everybody, number one, cannot provide the data. A lot of people are not on net. A lot of people don't have the Android phone and so on. So it's just definitely knocking the church quietly cool.
The situation, it's not really to our advantage, sort of. Although young ones like me could enjoy it, but to some extent. But it actually made some cut off from worship.
Virtual worshiping it does not bring the spiritual essence, and indeed the zeal of members are more often than not raised. Therefore, it is affecting the fellowship, is affecting service unto God, is affecting people coming together to worship God.
In his own view, the chief imam of the Awka Central Mosque, Malam Umar, who described coronavirus disease as a God-sent disease to check the excesses of humanity, even as he explained that men and women of the world has departed from the path of righteousness and chose the path of evil. Similarly, an Islamic scholar, Alhaji Sani, in his contribution said, online worship is not recognized in Islam as far as Salat prayers is concerned, but Dua prayer can be done online.
Worshipping online is acceptable, only that worship is of various categories. It depends on the type of worship we are talking about. If it is as-salat, whether during the time of COVID-19 or not, salat is not observed online because you cannot stay in a place that is far from the place where your imam is standing.
A review of life in time of COVID-19 pandemic reveals the fact that Nigerians and the world at large will definitely survive the menace of the COVID-19 pandemic by adhering strictly to its protocols anywhere they find themselves, even in worship centers.
All right, we're back from Oka, and that's the situation with the online worship. Not terrible, and I know that if you visit churches, as of today in FCT, I try to go around, a lot of social distancing is happening, and a lot of face mask wearing is also happening. And I think that's in compliance with the president's rule that we must wear our face mask. Let me quickly introduce my guest in the house and take on another feature before I ask my question. I have with me a medical doctor, precisely the Director Special Duties, FCT Health Secretariat, and Chief Consultant Physician in Public Health, Dr. Matthew Ashekini. Thank you for joining us.
Thank you.
All right, I will be, having my chat with you, but let's quickly touch base with Aisha, who will enlighten us with where we are now with COVID-19 and the new norm, especially in regards to all the task force enforcement and laws and all that. Let's see it.
On the 7th of February 2021, confirmed cases of COVID-19 in Nigeria numbered 139,748, with new cases increasing daily. As a result of the constantly increasing numbers of COVID-19 cases, President Muhammadu Buhari, on the 27th of January 2021, signed the COVID-19 Health Protection Regulations 2021, a new law aimed at controlling the pandemic in Nigeria. According to the regulations signed by the President, any person that contravenes the provision of the regulations upon conviction risks a fine or a term of 6 months imprisonment, or both.
I use my nose mask almost all the time. If I come out from my house, I use my nose mask. If I want to enter mosque, that one is necessary. If you don't even put your nose mask, they will not even allow you to enter mosque. If you want to enter the office, you also use our nose mask.
I use my nose mask whenever I'm going out of my house. Coronavirus is real, and I urge everyone to take it serious because it's actually real.
According to SGF, Boss Mustafa, Nigeria has recorded over 13 cases of the B117 variant of COVID-19 in Nigeria. You will recall there was a discovery of the new strain of the virus in Nigeria in 2020. Virologist Sunday Omilabu is amongst the many researchers who spent the holiday season doing genetic sequencing. According to him, the variant discovered in the United Kingdom and South Africa are different from the variant discovered in Nigeria.
The doctors have said it that COVID-19 exists. So far I'm not a doctor. I don't have the right to say no.
Whenever you are going out, just stay safe. Maintain social distance. Use your nose mask. Do whatever the people in charge want us to do. Don't go against the rule.
Last year, the second phase of lockdown commenced in June and lasted for 4 weeks, ending on the 29th of June 2020. Many feared the idea of another lockdown, stating the immense challenges that might follow, especially with the experiences of the first.
I have it in my pocket here. You can see it. I have mine here, but I don't always use it because I'm not feeling good when I'm putting it on.
Most people don't use hand sanitizers, they don't wash their hands often, they don't even use face masks. Some people don't even believe that COVID-19 even exists.
But it goes without saying that if Nigerians do not comply with the NCDC COVID-19 guidelines diligently, there will be a spike in cases and another lockdown inevitable. Here are tips on how to reduce the spread of the COVID-19 virus. Observe physical distancing. Wear a face mask. If your face mask is not a disposable one, wash it regularly. Wash your hands frequently. Our hands are vital parts of our body and can easily spread germs or viruses to our eyes, nose, or mouth without even realizing it. In spite of washing your hands, you should also move around with a hand sanitizer. Healthy diet is also essential to boost the immune system. Eating vegetables, fruits, taking fresh ginger tea, juice, and stay hydrated. We must all do our part to minimize the impact of this virus and hopefully eradicate it.
Okay, that was Aisha on where we are with COVID-19. And I earlier introduced my guest to you, Dr. Matthews Ashikini. And while we were listening and watching that particular feature, something came up. The man said, the doctor said there is COVID-19. And we all started laughing because obviously he is not saying it exists.
Yeah.
He says that's what the doctor said. Okay, because the doctor said we believe. What's your take on that?
Yeah, it's the disease is a new phenomenon, and yeah, we are not surprised when some people believe or do not believe that it exists. It only means that we need to engage more with our people and also get them to know that as health workers and professionals, we are highly professional. We will not for any reason come out to say that this thing exists if it is not there. We face this on a very serious and daily basis. We see a lot of people come in and many of them do not survive it. So it's real, and we only hope that with more programs like this, enlightenment, people will not wait to become the victims before they believe. It's better you believe now than to have misgivings and you become the victim.
When they say, I want to see somebody with it.
I want to see somebody with
somebody
it.
die.
Or somebody die. Be careful, because you may be the one people will point fingers that Mr. XYZ had COVID and died from it. God forbid. We don't want it to reach that situation. And as health professionals, public health experts, we believe in prevention and reducing the impact of such diseases. So we keep talking, we keep sensitizing our people, we keep engaging with them, advocating, and do all sorts of means of communication to ensure that they prevent it. Even if you don't believe, prevent it.
It's a concern, really, for me, because sometimes you meet people that are high placed and people you assume are very knowledgeable. Maybe they are, and you have a conversation around them, and you find out that maybe when the camera is open, They are telling you, okay, there is COVID-19. When the camera is shot, they are telling you it's not an issue. How do we begin to tackle it when people we look up to are not talking with from two different sides of the mouth?
Yeah, that's the unfortunate thing that is happening. You find very highly placed people coming out even in public to say they don't believe, which it's really unfortunate. It makes our job more difficult because for us to reach out to the ordinary Nigerians that look up to these particular people as role models and mentors, it becomes more difficult. But we'll continue. We will not give up. We won't give up. We'll continue to advocate and also explain to the highly placed Nigerians to also join the efforts of government and the health community globally. This is not a disease of Nigeria. It's not a disease of FCT. It's a global disease that has impacted severely on the world, global economy, global health, social life, even worship. And we have, I think it's just mischief, on the part of many people, because you have seen it. If you have not had it, you must have seen somebody or come close to somebody that knows somebody that has suffered COVID. And the media is awash with the number of high-profile people that have died from COVID. So it's really sad, but we will not relent in our efforts. In public health, we believe in making you understand the disease situation, and voluntarily, hopefully, you change so that it becomes part of you. You don't need to be forced. You don't wait to be forced. You understand what is happening and you try to protect yourself and save yourself, your loved ones, your friends from the disease. But unfortunately in Nigeria, because, people, for instance, will beat traffic light if there is no traffic warden around, it becomes part of us that we want to be policed or somehow want the law enforcement agents to be near us before we do what is right. So you can see that it took some time. We have been trying to talk to people, but it wasn't helping. The disease was instead increasing. With the second wave, we are seeing more cases. We are seeing more severe cases.
More deaths.
We are getting more overwhelmed, more deaths. And by the time you start having thousands of cases every day, you wonder what capacity do you have to manage these cases. So it became, I think, almost impossible not to enforce some rules and regulations as regards to COVID.
One other thing that bothers me is sometimes the attitude of not medical practitioners, not possibly medical workers, but people around them. I'm speaking from experience. I walked into a big hospital here in Abuja, and I found a security man wearing the nose mask as the neck mask.
Chin.
Chin, yeah. And I was a little concerned because before I summed up courage to enter the hospital, I had to cancel myself. I had to pray. I had to cover myself with both everything because I was going to a hospital environment. I was really scared. But here was a security man very close to the emergency area wearing this. And I know emergency is the first port of call.
Yeah.
How do we begin to react? I mean, you as a person working in such places, when our security men do not even believe or behave in accordance with that.
Yes, your security, your other domestic aids, right? The house helps, the driver. These are people that their understanding is very low. They may not understand why they have to do it. They may wear it for a while, and after some time you see them lowering their guard. And many of them have come down with COVID, many. And we have advocated to all these big health institutions that preventing COVID does not end or begin and end with the health workers. You must take it down to the various staff who are working in the facility, because the health facility is where sick people come to. So, and COVID presents like malaria or common cold, just like any other febrile illness. And if you don't have that high index of suspicion and alert, you must be in alert mode. Everybody, right from the security, the records people, the nurses, the doctors, everybody must take this seriously and protect himself and take those preventive measures very seriously.
Okay.
Otherwise, it will become, a vicious cycle. You get it from your house help or your security. You treat, you're lucky, you recover. There's no long immunity.
I know that at the peak of it in the
Western
foreign
world,
clime, a lot of consultations happened on the phone.
Yes.
Video calls and all that. Are we thinking about it here?
Yeah, definitely. The world is moving, the world has changed. You need to consult virtually, maybe on the phone or using the video calls. That could be done when the patient and the health worker both agree and have access to the facility. But it is a very important means of preventing direct contact between the health worker and the patient. But having said that, there are certain situations that you cannot but help. If you need a surgery, for instance, you cannot have it at home.
Definitely.
Like you needed to access the dental care, if you needed a refill, for instance, you cannot do that at home. But simple, at least the first few contacts, you could call your doctor and say, I'm coming, and then agree on the time and how to come, so that you come prepared. The doctor is also ready. He doesn't give too many people appointments on that day so that people are not crowded in the place. So we still have to do a lot of virtual communication, one way or the other. And like you said, in other parts of the world, it has gone very far. But in our own part of the world, it is slowly catching up. Most of the city center facilities are doing that. We do sometimes remote, consultations. Sometimes you find a health facility in the remote area communicating with the specialist clinic or the tertiary institution, and the health workers are communicating by telemedicine. But in the really remote areas, they need, connectivity. You need power. You need to have access to the kind of phones that you can do that. So it's a bit limited here, but we encourage it more and more, especially as we're in this second wave with more cases. Any consultation that can be done virtually is welcome.
Advisable.
Yeah.
All right, just before we go, I know that we will continue to preach, advocate, and all that. But on the parting notes, I've heard about double mask wearing now and all that. You want to speak on that?
Yeah, like I said, COVID is new. A lot of things are coming up every day. New variants of the virus, new vaccines, and new ways of prevention. One of them is double masking. Some say that if you wear double mask, the protection is more. All right. If this one mask can give you about 70%, 50 to 70% protection, if you double it, it rises to about 90 to 95%. So
how about the breathing part of it? I'll suffocate, right?
Yeah, that's another point. People, even with one mask, people find it difficult to manage. So I'm wondering, with two masks, how will you manage? How will you cope? But another way out is to loop the edge of your mask. That's another.
I notice you do that for your own.
So when you loop, all right, you tie a knot at the end like this.
Okay, like I have my own here.
Yes. So you do a knot at as close as possible to
like this?
Yes.
Okay.
As close as possible.
As close as possible.
Yeah, to the mask itself. Yeah, you do the other side.
Is that it?
Yes.
I got it here.
You got it. So you have to do the second one.
The second one as well. Okay.
Yeah.
So this is how it is naturally.
Then you talk.
Because I kept watching your own, and I was like, your own is different from mine.
Then you talk it in a little bit. Tuck the edge in.
Okay.
And you're good to go.
Okay, this is it.
Yeah.
Okay. All right.
You have to tuck the edge tighter in. Yeah, it reduces the gaps. There is some space between your face and the mask, and the virus is airborne. So the chances that the virus may, still slip in through some of those gaps. And people believe that when you knot this way, you reduce those gaps and space between you and the mask so that it becomes virtually impossible for any virus to penetrate.
Right.
And then, of course, others say you wear better fitting face mask so that it doesn't keep rolling down. So your face
I see
mask.
some people when they are talking, they're doing like this.
Exactly. So,
All right, thank you
wear
so
the
much.
mask that fits you properly.
Okay.
And that gives you additional protection.
It's always a pleasure to have you, Dr. Ashikine. I know it's been a long time we've been having a chat, right from the days of Healthline up until now. It's good having you again. So we've been speaking with the Director Special Duties, Federal Capital Territory Health Secretariat, and Chief Consultant Physician in Public Health, Dr. Matthews Ashikine. Thank you. I told you that today is Valentine and I have special. I also asked you to write me letters as they wrote it those days, the apple of my eyes, all those kind of funny letters they write during Valentine. I read it out, but you didn't. And I still have my cake, I have the wine, and all geared up to celebrate today. But celebration all alone is not possible. The house is usually full, though. You don't get to see everybody, but there's so many people behind the camera. I have 3 lovely cameramen. I have the floor manager. I have my serial producer. I have my lovely producer as well. I have several other people. I have to bring some of them. Thelma, my producer, you need to come and join me. I spot you, Mr. Charles. You need to come and join me. Yes. And I offer you this as you're coming. I don't know what you've been doing with your hands.
You're kidding me.
Please, can we stand and get this
preparing
done?
your package for today.
All right, so we need to do this.
Okay. We wish Mr. Bayo was here.
Yeah, Mr. Bayo. So
ask him to join us.
So you do it yourself. I will just count. No, let me not hold it.
Is he my date? He's your date. He's taking you out right after.
Are you serious?
Yes. That's
I'm having a great time.
All right, so
2 vows today.
So 2 vows.
Yeah.
1 man. All right, let's go there. Happy Valentine's Day.
Super fantastic.
All right, thank you very much. You have to help us open up the wine. Let's toast to our fans.
Okay.
I wish 1 or 2 of them came in to join us from their homes.
They're your beautiful daughters.
Yeah, lovely.
First.
Okay, after the gentleman. I still gave you first. All right. Wow. Mr. BK.
Yes, please.
When you first toasted your wife for marriage, what was the line like?
I told her, babe, you look like my blue in the sky. The only blue I have in the sky, that was what I told her.
Blue?
Not red, not Valentine red, not pink.
The red actually came up afterwards to tint the blue and brought out the
children.
Color, and the children were blessed with children. So
wow.
It's a pleasure to be with all of you.
All right, thank you.
Ladies in NTA.
Thank you. And we also want to remind you that Valentine is not just about husband and wife. It's not just about mother and children. It's not just about family. There are people out there who need a smile. It could just be a smile. Do us that favor. Stretch out your hands and love, even if it's just one person today. Somebody who you will not get a thank you from, if it's possible. Talk less of a reward for whatever you show. Show some love today, and I'm showing you with one. Happy Val.
Happy Valentine's Day.
Happy Val.
Wonderful.
Thank you.
Happy me.
Elizabeth, I hope you spending the vows day together.
Are you